When two hospital systems merge, or a larger system acquires a smaller one, the first reaction for many community residents might be, uh-oh, what does this mean for me? But the latest research confirms some good news. Hospital mergers can generate significant value for patients in their communities, including better care and reduced costs. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, senior writer with the AHA. Hospital merger benefits, views from hospital leaders, and econometric analysis and update is the title of a study prepared by economists from Charles River Associates in Boston. It's an update of their 2017 report. The 2019 analysis reiterates and expands upon the key findings of the first report, offering conclusions that should reassure healthcare consumers. The big takeaway? More often than not, mergers between hospitals and healthcare systems enhance patient care through the expansion of clinical best practices. They can also reduce costs and greatly improve a hospital's ability to address the impact of social determinants of health on their communities. How exactly do these welcome benefits come about? Here to explain in more detail are the report's two authors. Dr. Monica Noether is a vice president at Charles River Associates and the paper's lead author. She is joined by Dr. Sean May, also a VP at CRA, and the study's co-author. Monica and Sean, thank you for joining me today on Advancing Health. So, mergers is a term that makes some people uneasy, with connotations of raw market capitalism and bigger fish gobbling up smaller fish. Yet in the healthcare landscape, mergers appears to be yielding some good things for patients and their pocketbooks. Please tell me more about the CRA study and its key findings.
So the study, the updated study, is a follow-on to a study we did 3 years ago. And like the previous study, I think it combines two distinct but complementary components. One of those components is an empirical econometric analysis of what happened to acquired hospitals in terms of their costs and their revenue and patient outcomes, so quality measures of mortality and readmissions. And the other component of the study was an interview with hospital leaders about what they tried to achieve in hospital acquisitions and the processes by which they achieve those goals. So the empirical analysis I think of as telling us what happened as a result of hospital acquisitions, and I think of the interviews as telling us about why those things happened, what hospitals did to achieve those goals.
And how it happened.
Yes. So in terms of our specific empirical findings, so as I mentioned, we look at three categories of outcomes. One was we looked at cost per admission at acquired hospitals, and we found that cost per admission at acquired hospitals fell by about 2.5% relative to peer hospitals. Some of these hospitals have costs hundreds of millions of dollars, so savings of 2.5% is millions of dollars in reduced costs every year. The other outcome we looked at was revenue per adjusted admission, so how much money the hospital is taking in from Medicare, Medicaid, commercial insurers. We found that decreased by about 3.5% relative to comparison to hospitals. And again, hospital revenue for some of these systems is in the hundreds of millions of dollars. So a reduction of 3.5% in revenue is millions of dollars less that consumers or insurers are paying for the care they're receiving. And then I think most importantly, we looked at measures of quality. So we looked at readmission rates for three medical conditions, for heart attacks, for heart failure and pneumonia, and mortality rates for those three medical conditions, heart attacks, pneumonia, and heart failure, and found that for both readmissions and mortality rates, acquired hospitals had statistically significant declines relative to their peer comparison hospitals.
Well, I think it's important to note that we are one of the few, if not only, study that looked at the universe of hospital mergers that occurred in the U.S. over a 9-year period, so much more comprehensive than other studies. And that the findings were, as Sean said, complemented by the interviews that we did with hospital leaders. And in fact, the things that they cited were very consistent with the econometric results, namely that mergers achieve scale, and that scale is really critical, particularly in the current operating environment, to permit the kinds of investments that can allow them to achieve savings and improve quality.
So why is scale so important to realizing the potential benefits of a merger?
I think there's a baseline benefit to scale that we heard fairly consistently about, and that was that scale allows hospitals to reduce costs. And I think there are at least two mechanisms that happens through. One is that some hospitals have fixed costs, so the cost of human resources or legal department or information technology. And as you get bigger, you're amortizing that cost, spreading that cost out over a larger patient base, and that reduces costs. I think the other thing that you get as you get bigger in terms of cost savings is that hospitals can purchase supplies or pharmaceuticals more cheaply than they could individually. So it's both a spreading out of fixed costs over more patients and a reduction of the variable costs, the incremental costs of providing care to patients.
And I think a particular piece of that scale is the increasing importance of data infrastructure necessary to promote value-based care. And there are huge fixed costs, both with developing that data infrastructure and getting the data loaded into the data infrastructure, and then maintaining that, and then spitting out the kinds of reports that you give to clinicians that then enable the clinicians to make the important clinical decisions about optimal practice patterns. And all of those things require a lot of scale.
We heard earlier today from the CEO of a large health system who said that one of the goals of the health system was reduce maternal deaths. And the hospital had 70,000 births in its hospitals every year. Maternal deaths are thankfully fairly rare, but more common than they perhaps should be. You need a lot of data to be able to sort of analyze the causes of maternal deaths and reduce the incidence. So having that scale allows a big system like Providence St. Joseph to have this sort of the data framework and analytical capabilities to isolate the effects of maternal deaths and reduce them. That's something that a hospital that delivered a few hundred babies a year couldn't affect.
So you've listed some significant advantages that can result from hospitals or health systems merging. But to what extent do these advantages depend on merging hospitals' ability to align their cultures and harmonize their clinical practice patterns?
That's the kind of question that I think would be very difficult to address purely by an econometric analysis, but in fact the interviews with the system leaders who had gone through various mergers made really clear and were very, very consistent in their views that what a merger enables them to do essentially is bring medical staffs together from different hospitals and give them their own data to look at on practice patterns, but also just get them to spend time together and to align on common practice patterns, which are so key to achieving both cost savings and quality benefits. Clinicians very much want to look at their own data, but they are very interested in their own data, and being able through a merger to, as Sean mentioned, bring them large quantities of data, both on cost and on quality, different clinical data that look at differences in outcomes based on different procedures, is a very important tool and enables the physicians all to work together and kind of feel like they're kind of moving in the same direction at improving patient care. And that's really hard to do if you can't combine the data, and without a common ownership structure, hospitals find it very difficult. A lot of the data are highly confidential, or they are cost and price data that they are legally prohibited from combining. So merger really not just facilitates, but really is critical to providing the kind of information that enables establishment of a common clinical culture.
We also, I think, over the course of both this update to our study and the previous study, asked hospital leaders to differentiate between situations in which they acquire or merge with a hospital and situations in which they have a contractual relationship with a hospital that falls short of merger acquisition. And I think one of the ways they distinguished those two situations is that an acquisition or a merger allows them to better align the clinical staffs of the two hospitals, that being part of a system gives physicians and clinical staff ownership sort of buy-in in a way that maybe being part of a joint venture or contractual arrangement doesn't. And I think that the buy-in of the doctors and the nurses and the clinical staff is important to achieving these quality benefits.
Yeah, and I think beyond the clinical culture, there's the economic incentives as well. And when you have independent hospitals, it's very hard to align those incentives, particularly if what you're trying to do is share services, share staff, things like that. It's very hard to do that if different hospitals feel like they have different economic incentives.
How well do the 3 additional years of data now available through the updated study reinforce the original conclusions, and what new conclusions can we draw?
The 3 additional years of data, the 2015, 2016, and 2017 data that we added in addition to the 2009 to 2014 data, allows us to do 2 things. The first thing it lets us do is we have more data on what happened after mergers that occurred from 2009 to 2014. So we have 3 more years of post-merger data to look for changes in costs or revenue or mortality or readmission rates. The second thing it allows us to do is it allows us to look at additional mergers. So we have some mergers that happened in 2015, 2016, or 2017, and we can include those in our study to see what happened with those particular mergers. I think on the cost and revenue side, the results of this study are very consistent with our first one. That is, we see statistically significant declines in cost per adjusted admission and in revenue per adjusted admission. Costs go down by about 2.5%. Revenue goes down by about 2 or 3.5 to 4% per adjusted admission. The quality findings, I think, are interesting and important in this new study. I think our first study found directionally it looked like mortality rates and readmission rates were going down at acquired hospitals, but not by a statistically significant amount. The addition of more data and statistics is useful because it allows you to get more precise estimates. Now we're finding that mortality rates and readmission rates are going down by statistically significant amounts, which is certainly good for patients.
How are the larger entities that result from mergers better equipped to address social determinants of health? And what promise does that hold for more holistic patient care in the future?
As health systems focus increasingly on addressing the continuum of care needs in a value-based framework, I think alignment with other types of healthcare service providers has become more important. So even within the healthcare arena, there's more attention being paid to making sure that you're developing and providing the right care at the right time and in the right setting. So beyond horizontal combinations of general acute care hospitals, there's an increasing emphasis on vertical transactions that combine providers at different stages of the care continuum. For example, the acquisition of urgent care clinics by general acute care hospitals or rehab facilities, things like that. And we found that as with horizontal affiliations, health systems prefer an ownership model because it provides them a greater ability to align incentives more effectively. But there is a caveat, and that is having the requisite expertise to manage these other stages of the continuum is also very important. So sometimes looser joint ventures with entities in other parts of the continuum provide that valuable specialized expertise outside of the hospital environment. And then moving back and getting back into the social determinants of health, which extend beyond the delivery of the package of healthcare services, but really focus more on population health that needs to recognize that there are a variety of social services that particularly vulnerable populations have difficulty accessing. And larger health systems developed through mergers and acquisitions have a much greater ability to work with the communities in which they operate to invest in ways that provide patients with access to adequate food, housing, education, employment, and other kinds of services that enable patients then to be able to use the healthcare system for what it's intended to.
One of the things that was different in the update to this study was I think we heard more consistently from hospital leaders that they were thinking about vertical transactions, that they're still interested in all the benefits that come from acquiring other hospitals. But I did hear much more interest in urgent care centers, in outpatient surgical centers, in post-acute care centers. And then I think that there was a new focus on thinking about how to serve the community more broadly outside of just providing healthcare services. So thinking about how to providing shelter for people experiencing homelessness or better food security for people in the community. That was, I think, a new emphasis that we heard in these latest interviews.
All right, let's say for a minute that Jane Q. Citizen of Anytown, USA, gets wind that the hospital in her community is being acquired by a larger health system. If you could speak to her personally, what would you tell her in terms of what to expect?
Yeah, I think in those situations there often is an initial apprehension about an outsider coming in and controlling what is viewed as a very local, personalized kind of service. But it's been our experience both, first of all, in looking at the econometric results with quality benefits, but also the experience that we've had in actually working with hospitals who undertake mergers. And helping them think through, how they're going to implement the improvements that the mergers are intended to achieve. In fact, what often is the case is that services at the local community hospital are actually going to increase after it's been acquired. Often the community hospital on an independent basis hasn't had the financial wherewithal to invest, to upgrade facilities and maintain facilities that physicians are happy to bring their patients to. And so the acquisition, in fact, will improve access to care. And consistent with that, often when community hospitals are acquired by larger, broader institutions, it becomes easier to recruit physicians or establish linkages with the diverse and large medical staff at the larger system. So again, that's a way of enhancing services in the local community. And often the hospital that's doing the acquiring is in fact happy to be able to find ways to keep patients who can be treated at the local community hospital local, because it frees up their beds, which are often overcrowded, to deal with the really complicated cases that have to be in an academic tertiary community. And then finally, I think for the citizen of the local community whose hospital is being acquired, I think there's an increase in when should she perhaps need really specialized services that can only be done at a high volume academic medical center, say, the kind of transition and communication between her providers in her local community and the tertiary center is facilitated by the kinds of data infrastructure and information sharing that we were talking about earlier.
I think I would emphasize that to the extent there's concern in the community that services will be taken out of the local hospital and people will be moved to a big academic medical center, I think the hospital leaders we spoke to understand that people prefer to receive care locally, and they understand as the society moves towards value-based care and managing the total cost of expenditures, that providing care for everybody in a very expensive academic medical center is not the right answer. That keeping care local when it's safe and appropriate to do so is the goal. So I think often we see services at local community hospitals being enhanced, not reduced, and people are not being shunted off to city hospitals or academic medical centers. The goal is to keep people in their local communities where they've received care historically.
I'm sure these questions haven't fully covered a study of this size and complexity. What else would you like to say about it for our listeners?
I think maybe the one feature that has become more apparent since we did the initial version of the study, and certainly was articulated by the health system leaders with whom we spoke, as well as you kind of read about it in the trade press every day, is the emergence of new players in the healthcare space that are really affecting the entire industry. These are players that are focused on advances in information technology, artificial intelligence, and perhaps most importantly, consumer-directed management of their own healthcare, particularly patients who suffer from chronic diseases. And I'm speaking of players such as, the recent combination of Aetna and CVS, or players like Amazon or Google. And once again, I think larger health systems are better equipped than traditional independent hospitals to address these areas of increased focus to best serve the health needs of patients in their communities.
As hospitals respond to the increasing pressure of healthcare reform, many hospital leaders believe that mergers are an effective means for making progress toward meeting the aims of value-based population health. This study confirms they're on the right track. This has been Advancing Health, a podcast from the American Hospital Association. Thanks for listening.